Hello viewers, welcome back to my channel. In my previous videos I have talked about how to make the transition from high school to medical college, how to become a specialist by negotiating medical college, and I have also talked about how to become an ENT specialist. In today's video I will talk about what you can do after becoming an ENT specialist and what people usually do. At the end of the video I'll also suggest what I believe is the best course of action after becoming a specialist in ENT. So let's get into it. Broadly speaking, after becoming a specialist in ENT, assuming there is no mandatory rural service bond, then a person is presented with three possibilities. One, the person can start their own private practice, something which I will not talk about in this video. And the other two things which I will talk about in this video: looking for further training opportunities and looking for a job. So let's first talk about how a person who has just completed post-graduation in ENT can look for further training opportunities. The logical option that many people look at is getting an opportunity to work as a senior resident. Now, what is a senior resident? Senior resident is basically a bridging post where you are no longer a postgraduate student and you're also not a senior doctor. So you're basically bridging postgraduate students to senior doctors. So you have the responsibility of supervising postgraduate students, but you're also working yourself under supervision of senior doctors. This is a very lucrative opportunity because you get the opportunity of both teaching and learning, and while you're at it, you also get paid. Especially in surgical specialties, senior residency is of utmost importance because you get an opportunity both to fine-tune your own skills, to teach other people, which also helps you learn yourself, and you get an opportunity to participate in those surgeries which you may not have got a chance to perform yourself or learn in great detail during post-graduation. So senior residency can be done in almost all medical colleges in India, whether it is government or private. Each medical college issues their own notices, notifications, advertisements talking about their vacancies, and you can apply for them. Even premier institutes like AIMS New Delhi issue vacancy notices and you can participate in the process. I believe in AIMS the selection process is very strict. If you do well in them, you can join AIMS New Delhi as a senior resident, and also other colleges. Typically senior residency is of a 3-year duration, but this duration can vary from college to college from time to time. The next available option regarding further training is fellowship. Now, fellowships are more focused training opportunities compared to senior residency. Senior residency is training in all aspects of ENT. Fellowships usually are in a particular aspect of ENT, such as head and neck cancer, fellowships for which are available in places like HCG Bangalore. There can be fellowships in cochlear implant, which is available in some places in Maharashtra. So once you join a fellowship program, which again is very competitive and you have to perform really well in the selection process, again you will find the notifications regarding vacancies if you follow a particular program, and whenever the vacancies are available you have to apply for it, and if you do well in the application in the selection process, then you get selected. Typically fellowships are of 1 to 3 years duration. Some fellowships are 3 years, some are of 2 years, some maybe even less, and usually you get paid but probably not a significant sum during the tenure of your fellowship. At the end of the fellowship, you get a formal certificate stating that you have completed fellowship in that particular field of ENT, which is definitely valuable, and some people do include it in their CV, as they should, because it does embellish your resume. Now, apart from fellowship and senior residency, you can join a formal further training degree program such as MCH. Now, after MBBS, specialization in the surgical field carries the degree of MS, and after MS you can further obtain a degree for super specialization, which is called MCH. Now, MCH after MS E.N.T is usually available in head and neck surgery. Now, there are 2 exams for super specialization. One is called NEET SS. NEET is the same as NEET UG and NEET PG, National Eligibility Cum Entrance Test. SS stands for super specialization. And there is also another exam called INISS, Institutes of National Importance, Super Specialization. Which institutes are considered nationally important? All AIMS, JIPMER in Pondicherry, PGI in Chandigarh, NIMHANS in Bangalore, and SCT IMST in Thiruvananthapuram. These colleges are included in INI CET for post-graduation and INI SS for super specialization. Now, NEET SS is a 150 question multiple choice exam, 150 multiple choice questions lasting for 2.5 hours, and INI super specialization is an 80 multiple choice question exam lasting for 90 minutes. In NEET SS, you have 4 positive marks for a correct answer and 1 negative mark for an incorrect answer. In INI SS, you have 1 mark for a correct answer and negative 1/3 for each incorrect answer. The most important point here is NEET SS does not have any maximum attempt limit, does not have an upper age criteria. However, for INI SS, there is an upper age criteria, such as you cannot be older than 35 years if you want to join a super specialization course in AIMS. You cannot be older than 45 years if you want to join a super specialization course in PGI Chandigarh. You cannot be older than 37 years if you want to join a super specialization course in NIMHANS. You cannot be older than 40 years if you want to join a super specialization course in SCT IMST in Thiruvananthapuram. However, in JIPMER, there is no upper age criteria. In AIMS, you can pursue MCH in plastic surgery after completing post-graduation in ENT, same for surgical oncology. However, through NEET SS, which remember does not have any upper age criteria, does not have any maximum attempt criteria, the only super specialist degree available to postgraduates in ENT is MCH head and neck surgery, where all the questions are asked from the core curriculum of ENT. ENT is the feeder subject for MCH head and neck surgery, although I must add that people who have completed post-graduation general surgery are also eligible for MCH head and neck surgery, but they have to read the MS E.N.T level curriculum to do well in the NEET SS exam for MCH head and neck surgery. Now, if you have any issues regarding age or maybe some other issues and you want to pursue further training and none of these options are making sense to you, none of these options appeal to you, then you can think about MRCS ENT, which is probably the single most commonly addressed topic on this channel. So I have made detailed videos on MRCS ENT, who is eligible for it, how to pass it, what to do after passing it. MRCS ENT, for simplicity's sake, is an opportunity for you to participate in specialist training in the UK as well as work as a specialist doctor in the UK in the field of ENT. How to go about it? Please browse my channel and you will find answers to possibly every question you have regarding MRCS ENT. So with this out of the way, let's now focus on the looking for jobs option after post-graduation in ENT. Now, jobs can be, you can look for private sector jobs, you can also look for government sector jobs. Jobs can be divided broadly in both private sector and government sector into two groups: teaching jobs and non-teaching jobs. Teaching jobs basically refer to jobs in medical colleges. Medical colleges can be private medical colleges, they can also be government medical colleges. Of course, in this case, government jobs are, when it comes to teaching jobs, government jobs are more difficult to get compared to private sector teaching jobs. However, when it comes to non-teaching jobs, I would believe that government sector jobs are easier to get than private sector jobs. How do you get it? Of course, you have to, for private sector jobs, you can upload your resume on online job portals and you can get in touch with, depending upon the vacancies available, you can apply and they will get in touch with you, and depending upon your performance in the interview and if the job meets your criteria, you can start working either in a non-teaching capacity or in a teaching capacity. In government sector job, same philosophy, again notifications are issued, and I do believe that non-teaching jobs usually have more vacancies compared to the applicants, whereas the reverse is true in teaching jobs. Teaching jobs somehow are more lucrative. Now, why is this the case? And this is also, I believe, the best course of action after post-graduation in ENT. Whether you are teaching in a government sector or you are teaching in a private sector, you have to meet the criteria set by National Medical Commission. So if you are fulfilling the criteria, you're basically at a level which has been deemed by the National Medical Commission as good enough for you to teach medical students. So if you are teaching medical students, it is imperative that you also prepare to teach them. When you are preparing to teach medical students, you are also learning. While you are teaching them, you are learning. While you are evaluating them, you are learning. And this goes on. This becomes a virtuous cycle. The more you teach, the more you learn, and the more you learn from the teaching experience. Both the subject matter as well as in surgical specialties, you also get to fine-tune your skills, participate in more difficult surgeries, learn more advanced surgeries, and this, I believe, paradoxically, teaching is the best opportunity for learning and improving yourself as a specialist. So if you have to choose one option, I would suggest choose teaching. But teaching has its own disadvantages as well. In teaching, you have to balance different aspects. You are not just treating patients. So even in teaching jobs, you are treating patients. In non-teaching jobs, that's the only thing you're doing, treating patients. In teaching jobs, you have to balance treating patients with teaching medical students also. So that balancing act might be difficult for some people, and as a thumb rule, typically teaching jobs pay less than non-teaching jobs. So I hope I have been able to throw some light on the options available to you after post-graduation. Of course, the option of private practice is available to every specialist, and even people who have completed MBBS, and success in the field of private practice is something I am not qualified to talk about. So I hope you enjoyed watching this video. Take care, bye bye, and please don't forget to be awesome.